Hi, I'm Katie.
And I'm Dr. Stanley from the Smile Center.
And today we're going to be going over some of your frequently asked dental questions. So Dr. Stanley, what should you do if you have bleeding gums?
The first thing you need to do is go to your dentist, because that generally indicates you've got an infection around your teeth. So the other term for that is periodontal disease, which means infection around the tooth.
Okay.
So you have infection in the gum and the bone. And kind of like if you're washing your hands and you had bleeding with your hands or bleeding from underneath your fingernails, you'd realize you had a problem and you would go to the doctor.
Right.
When we have bleeding around the gums or in the mouth, we need to go to the dentist so it can be fully evaluated, because there's a variety of types of infections that can be caused by bacteria around the neck of the tooth and underneath the gums. And if you think of it like barnacles on the roots of the teeth that are very irritating and toxic to the gums, that's what causes the bleeding, so we need to clean that off. You could also have something like an abscess that could be bleeding into the mouth, and it actually has pus and blood that's draining into the mouth. And although you may not notice a lot at one time, if you think about how much is actually kind of coming out per hour, it's actually a considerable amount every hour and all day long that's draining into the mouth, and that needs to be addressed.
Okay, so as soon as you see bleeding gums, the good idea is to go to the dentist.
Absolutely. Even if it's just bleeding when you're brushing or flossing, you need to have it evaluated.
Okay, thank you, Dr. Stanley.
You're welcome.